Gramágadlas Cancorla, as has been said by others, up to 5,200 people, our relatives, friends, work colleagues, fellow citizens die from smoking every year, and that figure is nearly 20 times the number of people who lose their lives on Irish roads. And when it comes to road safety, while there's always some initial grumbling, the measures to improve the situation and save lives are put in place and adhered to, generally without a struggle. However, when it comes to tobacco, the situation is very different. The process of regulating and restricting the consumption of tobacco and cigarettes has been a struggle that has been ongoing for decades. The power and the might of the tobacco companies and their lobbyists has acted as a deterrent to legislators and public representatives across the world. Only this week we have heard from US public representatives on the threat that this current bill poses to business interests and rights. And this is indicative of a growing trend, as far as I can see, of international pressure being brought to bear on Irish public representatives and others. International groups, and more significantly international resources and money, are increasingly participating in the democratic process here in Ireland. We've seen this more recently in other health-related legislation, and I have no doubt we will see it again in the marriage equality referendum, most likely because the referendum will be the first nationwide referendum on that issue. Without doubt there will be influence from outside Ireland hoping to shape the outcome of extending the right of marriage to citizens irrespective of sexual orientation. On this issue of smoking, it is intriguing to see the pressure on lobbying in favour of tobacco consumption continuing long after the negative and deathly consequences have been demonstrated. For decades, the inescapable proof has been available to show that smoking kills. Smoking causes a range of illnesses which causes suffering and limits lives. Yet when we look at the progress made at combating this public health threat, we can see how slow it has been, not least because of the pressure placed on public representatives. In Ireland, the first efforts at effectively warning people of the dangers came in 1964 with the launch of the voluntary code on advertising. It was another 7 years before tobacco advertising was banned on TV, and yet another 7 years until the Oireachtas introduced legislation in the form of the Tobacco Products Control of Advertising, Sponsorship and Sales Promotion Act. A further 10 years passed before the sale of tobacco products to children was outlawed with the Tobacco Health Promotion and Protection Act of 1988. It was only in the 1990s and early years of this century that successive governments intensified efforts with the amendments and new regulations to tobacco control legislation, and perhaps the most widely known, the Public Health Tobacco Amendment Act 2004, which introduced the smoking ban in workplaces, as alluded to by Deputy Coffey. Health is a subject which occupies a huge number of column inches and radio and TV airtime, and most of the commentary and the news coverage is negative and unfairly so. The successes of our health system are rarely accepted or highlighted, and the Minister for Health is one of the most difficult jobs in any government. There's a constant barrage of criticism, a constant stream of negativity, which surely erodes confidence and positivity. However, nobody, no public representative, no lobbyist, no journalist or broadcaster or commentator can dispute the commitment of Minister Riley to combating the public health crisis that smoking represents. Minister Riley has been steadfast in his commitment to improving and protecting the health of the Irish people by tackling smoking and by utilising the National Parliament to achieve this. When we look at the facts, it beggars belief as to why there is so much opposition to tobacco control and other measures to help people avoid the deadly addiction. For example, 1 in 2 smokers will die of a tobacco-related disease. The cost to the state of tobacco-related diseases in 2009 was some 500 million. The cost to the state of premature mortality caused by smoking in 2009 was 3.5 billion. And again, to reiterate the most important fact, 5,200 Irish people from across every city, town and village in the country die prematurely from smoking-related illness every year. The Public Health Standardised Packaging of Tobacco Bill is the Minister's latest piece of legislation aimed at saving lives. It is not about restricting rights or damaging retailers, it is about saving lives. The bill will control the design and appearance of tobacco products and cigarette packaging. It will reduce the appeal of tobacco products, and nobody can deny that colourful and eye-catching packaging does attract the attention of consumers. It will increase the size of health warnings so that a person is left in no doubt about what smoking is gradually doing to them. It will also eliminate some of the nonsense that's peddled to mislead the consumers on the real effects of smoking. The bill, as many stakeholders with an interest in protecting and preserving public health agree, will discourage young people and hopefully adults from taking up smoking. Increased health warnings will give people further reasons to reflect on the activity. I'd like to commend, as others have, the amount of groups also that are involved in warning of the dangers of smoking. The Irish Cancer Society, ASH Ireland, the Asthma Society, Irish Heart Foundation, CRE in the west of Ireland in particular. There are a number of arguments against the bill, and I don't think they stand up to scrutiny. One argument is that it'll make counterfeiting easier. I would argue that if groups or criminal organisations are intent on counterfeiting tobacco products, then no amount of legislation will dissuade them from doing so, if they're intent on doing so. And another argument is that placing further restrictions on tobacco products harms the retail sector. It probably is a case that some businesses or retail stores or retail sales is generated through tobacco sales, and I know any of the retailers that have come to various committees would have talked about footfall. It gets footfall through the door and they go on and buy other products. However, it is realistic to expect the government it's unrealistic to expect the government to do nothing at all in combating an activity or an addiction which is so harmful to the person or to the wider society. Another concern regarding illegal and the whole problem with illegal cigarettes is the quality of the products themselves, the contents that they contain, higher levels of harmful products, and therefore that has an added health concern or added health effect. It's thought that up to 30% of cigarettes are illegal, and that's based on picking up packages of cigarettes or empty packages that are strewn on our streets, and to assessing them whether they've had duty paid, whether they have proper stamps on them. So that's a high level, and I commend all involved in the seizure of cigarettes over the last number of weeks here in Ireland, which was the biggest seizure in Europe this year. So it goes to show that we need to ensure that we continue with the vigilance against the criminals that are involved in the illicit trade. We also need to tighten the policing of those who are intent on breaking the law in the interest of health. We understand, obviously, in a recession that there's a need to save money, but the best way of saving money is not to convert from legal to illegal cigarettes, but to try and give them up entirely. And certainly this bill will, along with other measures, go some way towards reducing the amount of people who take up smoking. Another argument that has been put forward by some is the concerns intellectual property rights. However, as the Irish Cancer Society points out, the Irish Constitution protects property rights under Article 43(2) and Article 43. However, the Constitution also recognises that in a civil society, property rights have to be regulated by principles of social justice and in accordance with the common good. This legislation, seeking to introduce plain packaging, seeks to protect and promote public health by, in particular, preventing young persons from taking up smoking and consuming tobacco products. And also on the issues of trademarks, the Society points out the bill does not cause the loss of any rights under the Trademarks Act 1996, only a justified and proportionate restriction of the use of trademarks. We already restrict the use of tobacco-related trademark in that they cannot advertise on television, billboards, or in retail premises. And yet another argument against the bill is that no evidence exists to show that standardised packaging will put consumers off. If this was really the case, why do companies from every sector spend substantial amounts of money on creating packaging to attract customers? Why would companies go to this expense if it did not influence a person's purchasing choices? So clearly that is not correct or true. As we know, standardised packaging has been brought in Australia, and it has had an impact, a desired positive impact in reducing the amount of people smoking. Standardised packaging will reduce the appeal of tobacco products to young people. It will stop smokers believing that some cigarettes are less harmful than others. It will make health warnings more effective, and it will increase negative feelings about smoking, and that has been shown in surveys in Australia, which was the first country to introduce the packaging in December 2012. There are already positive indications from that country, and a recent study in the state of Victoria showed that those smoking from standardised pack perceived their cigarettes to be lower in quality, perceived their cigarettes as less satisfying than the previous year, were more likely to have thought about quitting at least once a day, rated quitting as a higher priority, and tended to support the policy on standardised packaging. Those are very positive indications. And they also found that a 78% increase in the number of calls to the quit line following the introduction of standardised packing, and that was based on the Medical Journal of Australia. And new research by the Cancer Council Victoria found that there was an observed decline in the number of patrons who were smoking when the packs were displayed on cafe tables. So I think that this is quite clearly shown that the policy does work, and if it didn't work, we wouldn't have the level of lobbying and the amount of people within the tobacco industry who are against this bill. They know that this bill can work. They know this bill will impact and help to reduce the amount of young people taking up smoking, and that's why I support it.